This video is sponsored by Amalena Children's Haven.
I'm Dr. Charles John Buckman, obstetrician gynecologist. I think sometimes women put pressure on themselves, as in they want to get back to normal in the shortest possible time. But I don't think it's very, very important. It takes a while. What you must realize is it took you 9 good months to get to where you got to. So you can't get it all off in a few months. It will take time. The good thing is majority of the weight you put on is fluid. So your breast becomes heavy, mostly fluid. The uterus becomes big. It's usually blood, and the uterus itself also becomes big. Also, apart from the blood in it, the uterus itself becomes big. So the weight is from the breast, the uterus, the baby, the fluid around the baby. Your blood volume too will increase as well. So after delivery, slowly you shed off a lot of the weight because the fluid a lot of the fluid comes out. The baby comes out, the placenta, which also contributes to the weight, will come out and all that. So to come back to your normal self, at least to get rid of the baby bump, the uterus will slowly become smaller. Usually by, let's say, 6 weeks, the uterus would have gone really down towards where it was previously. But then, especially if you've had multiple delivery, multiple pregnancy, like twins or more, the skin stretches. So it will take a while you need to do exercises and all that to get that skin tone back to its previous. And even that, it won't get back totally because it has stretched and it won't be able to get back to what it used to be. So I think women should just give themselves time, exercise, eat well, drink water, sleep well, because your baby needs for you to produce enough breast milk, so you should eat well. But some people want to shed off all the weight, so they don't want to eat. But if you don't eat, then you are sort of starving your baby, unless you want to do only formula feeds, which is not good for the baby, at least for the first 4 to 6 months. Breast milk has been shown to be the most important food for the baby. So I would suggest that we try not to put too much pressure on ourselves to get back to our usual self before the pregnancy. But it's a slow process. Yeah. Actually, from, let's say, 37 weeks, sometimes we actually recommend that you have intercourse. The reason being, there are some products in the semen which contain some hormones that would help set off labor. So regular sexual intercourse around that time would actually help you go into labor earlier than if you were not. Yeah, so that is one of the main reasons why we'll ask you to. But some women have the myth that if you don't engage in sexual activity, your vaginal area will not be dilated enough for the delivery of the baby. That is not true. The penis is very small compared to the baby's head. There's no way it's going to dilate the place for the baby to come out here. But it's more because it helps to set off labor.
This video was brought to you by Amalena Children's Haven, where every mother shops.